Hello, everyone. The outbreak of COVID-19 in China and its worldwide spread has caused hundreds of thousands of deaths so far. Hundreds of thousands of COVID-19 patients are said to have already been treated with traditional Chinese medicine in China. In over 90% of cases, the treatment should have been effective. However, the effectiveness of TCM in the fight against corona is not accepted in the Western countries due to the lack of solid scientific evidence and clinical data. Specifically, TCM theory, such as the meridian system, which guides all TCM treatments, has not been accepted in the Western world. Now, modern science meets traditional knowledge. What are the challenges and opportunities? Good afternoon. My name is Dieterle. I am a pharmacist. Today, I'm going to talk to you about applying TCM under German market regulations. It's a great honor for me to share my considerations with you about how scientific research results will find their way to the patient under German and European law. Let me briefly introduce myself. I was born in Saigon, Vietnam, now known as Ho Chi Minh City. Saigon is a great city with about 10 million inhabitants. It's a place where East meets West. In Vietnam, both Western and traditional medicine coexist. Each child becomes familiar with our traditional medicine through education and experience while growing up. TCM is not only a form of medicine, but also a part of our culture and philosophy of life. After coming to Germany, I studied pharmacy in Munich. Since then, I have improved my skills and deepened my understanding of TCM at different institutes in Vietnam and Germany. Since 1996, I have run pharmacies in Munich. From the beginning, I offered and practiced both TCM and Western medicine to serve my customers in a comprehensive manner. Let's have a look at the agenda for today. First, we will talk about the relevant legal structures in Germany and in the EU. Thereafter, we will look at the application of TCM under the respectable conditions in detail, including TCM raw herbs, TCM extract granules, and TCM finished drugs. Finally, I will draw some conclusions on how I see the further development of TCM here in Germany and Europe. Now let's look at the legalities. We have to distinguish between three levels: institutions, laws, and directives. Responsible for health matters of the population is, on the global level, the World Health Organization. Within the EU, it is the European Medicines Agency, and in Germany, it is the Federal Institute for Drugs and Medicinal Devices. The German drug law is the applicable law in Germany. The regulation on the operation in pharmacies is obligatory within the pharmacies in conjunction with the German medical book and the German drug codex. As you can see, it's a complex word between the institutions, laws, and directives ruling the game for TCM on different levels. The internal market of the European Union is a single market in which the free movement of goods, services, capitals, and persons is assured. The EU rules on the authorization, import, and production of medicines for human. A mutual recognition procedure exists to enable medicines already authorized in one EU country to be sold in another. The EU rules by regulating herbal medicinal products from third countries in context with the EU directives 2004/24/EC. Good GACP, good agricultural and collection practice for herbal starting materials, and GMP, good manufacturing practice, gain importance on a global level as well. Let's first talk about raw Chinese drugs. These herbs are being imported as food. In the context of a medical treatment, raw Chinese drugs are considered as medicine and can only be purchased in pharmacies. Two tests are required for this. One from the laboratory resulting in a test certificate, and two tests from the pharmacy. These tests must satisfy the following pieces of literature: the German medical book, the European medical books, and the Chinese medical book. Now with this chart, I want to show you how raw drugs are defined as medicine according to paragraph 2 German drug law, and two test requirements are being formulated according to paragraph 6 and paragraph 11 regulations on the operation in pharmacies. Proof of identity, purity, grade, and yield must satisfy at minimum the rules of the Chinese medical book. In addition, raw drugs must also be tested for contamination from heavy metals, pesticide residue, as well as microbial contamination and aflatoxin according to the European medical books. In summary, in order for Chinese herbs to be classified as medicine in a pharmaceutical context, the pharmacies must ensure that these products are of a high standard in terms of quality, safety, and harmlessness. Okay, now let's move on to single herb extract granules. As we know, decocting is the earliest and most popular method of preparing herbal medicines in the practice of TCM. However, decoction has some disadvantages, such as the time and inconvenience needed for preparation, and the practical problems relating to their transportation and storage, also the requirement to consume a large volume of unpleasant tasting medicine. Now, Chinese herb granules are classified in Germany as presentation of medicines. According to the Federal Constitutional Court of March 2011, the German drug law does not cover only medicines, but also products that are marketed as a means to cure or alleviate disease, thereby giving the impression of being a medicine, so-called presentation of medicine. And this is here the case with the Chinese herb extract granules. The importer needs an allowance according to paragraph 13 German drug law and must show a certificate that the drugs are being produced according to recognized principles in the country of origin, and that the laboratories and production sites are monitored on a regular basis like GMP and GACP. And testing in the pharmacy is complex and expensive. This chart shows the requirements of the test certificate and the test in the pharmacy. The test certificate must contain a declaration of the drug extract relation as outlined in the European medical books and must approved by a person with manufacturing license or by authorized experts. Tests on the identity of granules in the pharmacy currently accepted by the Bavarian government is the method of thin layer chromatography, which is extensive and costly. In this context, we have to recognize the independence of German federal states by converting German regulations. In Bavarian, for example, granules are not available commercially in most TCM pharmacies. And the same is true for the situation within EU member states. On one side, we have a single market in which the free movement of goods is assured. But on the other side, we have the independence of the EU member states when it comes to the national adoption of EU directives. This leads to a distortion of competition on a national and EU level. The consequence is the creation of a gray zone and internet market where safety and quality of goods can no longer be guaranteed. Okay. Now we have arrived at TCM finished drugs. The legal basis for admission of a medicine in Germany is paragraph 21 German drug law. This is the national adoption of the EU Directive 2001/83/EC. Documents about assessment of quality, efficacy, and safety must be provided. Data of efficacy and safety must be proven by a study or a study and literature data, mixed dossier. In the case of herbal medicinal products, a simplified process is possible. If the active substance has had general medical use for at least 10 years in the EU, then a simplified process is possible on a so-called basis of well-established use. For admission, the bibliographic data is sufficient. The literature used must be public and from recognized sources. Relevant for Chinese finished drugs is the registration as per EU Directives 2004/24/EC, a simplified form of registration of traditional herbal medicinal products. Traditional means that the medical appropriation of that compound has been documented for at least 30 years, including at least 15 years in the EU. As long as sufficient safety data and plausible efficacy are demonstrated, no clinical tests and trials on safety and efficacy are required. Other requirements are that the herbal medicinal products are intended to be used without the supervision of a medical practitioner and are not administered by injection. A full quality dossier, including GMP, is also required. Also, the procedure of registration is national. Registered products can be moved freely within the EU. However, the restriction of 15 years of documented use in the EU is a big hurdle for TCM products. The registration of traditional herbal medicinal products is a national process. To support EU member states on national procedures, as well as support a harmonization of the European market, the Committee of Herbal Medicinal Products from the European Medicines Agency established EU monographs and an EU list. These present a documented scientific opinion on the safety and efficacy data of herbal substances and their preparation intended for medical use. The panel of the committee is composed of experts from all member states of the European Economic Area, EEA. The community list is a living document to be enhanced on a continuous basis. If applicants can demonstrate that their traditional product complies with the EU list, no further evidence of the safe and traditional use is required. So this picture provides an overview of which institutions interrelate in terms of an admission or registration of a herbal medicinal product. It is important to understand that the national authorities are largely independent when it comes to their national adoption of EU directives. But in spite of that, an admission given by the EMA is valid across all EU member states. Well, in summary, we have discussed the fact that raw Chinese herbs are considered in context with the medical treatment as medicine and can only be purchased in pharmacy. Chinese single herb extract granules are not available commercially in most TCM pharmacies due to the high cost for proof of identity in the pharmacy. Registration of Chinese finished drugs requires a minimum of 15 years of documented use in the EU. Finally, let's take a moment to talk about exceptions. There are two exceptions in terms of how we can bring these drugs without admission or registration into the German market. According to paragraph 73 German drug law, Chinese finished drugs can be imported for single patients provided that they are marketable in their country of origin and on the basis of a medical prescription. Paragraph 21 German drug law, admission is not required for medicines being produced in a pharmacy on the basis of a medical prescription in stock of up to 100 units per day. It must be offered in compliance with the existing pharmacy regulations. So here, I see a possibility of how TCM finished drugs or remedies can safely and successfully be introduced into the German market. Now, I would like to come back to the question I asked at the beginning of the presentation. Modern science meets traditional knowledge. What are the challenges and opportunities? So as you can imagine when looking at this picture, a Western person comes from the left, an Eastern person from the right, and they meet each other in the middle. They can pass each other, or they can introduce themselves to each other. They can approach and learn from each other. It may take time and be challenging, but the gap between them will become smaller and smaller. The benefit is huge. Let me end my speech with an interesting incident I experienced a few years ago. When I was in Vietnam, I got to know an entrepreneur there who was looking for a German partner to execute a clinical study for his medicine according to international standards. His drug was based on herbal medicine to treat leukemia. In Vietnam, he had worked with it for more than 10 years successfully. I helped to identify a partner here in Germany, in Hamburg, but cost was so high that the whole thing unfortunately failed. So as you can see in this case, we have a solution for leukemia, which we could deliver in 3 years' time. It would be a natural remedy. We have a university in Hamburg that is willing to partner with us to conduct the research. We have an entrepreneur in Vietnam who is willing to partner with the university on the research. We need 3 years' time, and we need financial backing. If we have both of those in place, in 3 years' time, we will have a life-changing drug on the market. If we want to bring the benefits of Western and Eastern medicine closer together in the interest of our patients here in Europe, German and European laws and regulations need to be adapted in order to shorten recognition and approval process time, as well as lower cost. Due to the globalization and the presence of modern technologies nowadays, TCM has to first modernize to be accepted by Western nations. TCM modernization works best through cooperation with Western institutions. This includes the development of scientific research using modern technologies for diagnosis, treatment, and productions, and the validation of international quality and safety standards. To modernize TCM does not only mean research on plans for new drugs, it has to be a combined approach of Western medicine and TCM. TCM is already a personalized medicine, and Western medicine is starting to follow suit in order to offer more customized solutions to problems. And after all, man and nature mutually affect each other and should have a symbiotic relationship, which requires our respect for nature and our responsibility and obligation to preserve natural diversity for future generations. Thank you for your attention.